My name is Nina. I'm a nurse here at the VA. I work in the ICU. And for me, it's important that we protect our unions because that protects our patients. The more we can speak up for our patients and not be worried about retaliation, the better off they'll be. And I'm here for the vets.
And is this affecting the services to the veterans, what's happening?
Absolutely.
How is it affecting?
Well, so far we've had, our providers have been fired or have been reassigned to other locations. On my unit, we had a provider who was reassigned. So it definitely affects the quality of care that we can provide patients, and I just want to be able to do the best that we can for them.
And, I mean, these veterans, some of them are in very deep need of treatment, care. They've gone through hell and that kind of thing. I mean, what does it say about this country that they're trying to take away services for people who are desperately in need of them?
I think that they're trying to, pocket taxpayer money into corporate pockets. And so instead of being able to provide care for all vets, it's going to be limited, but a lot of people are going to get rich off of it. So
you think that that's the driving force, make more money?
I think so.
My name's Steve Gutierrez. I'm a national business representative with the National Federation of Federal Employees.
And we're out here at Veterans Hospital in San Francisco. What's going on with the unions here, and why are you having this action today?
So the reason why we're here today is because this administration canceled union contracts and canceled collective bargaining rights for these federal workers that support our nation's veterans. We think it's unlawful, it's illegal, it's downright unconstitutional, and these folks are here to spread their voice saying this is not okay with us. We support veterans, and the federal workforce supports our nation's veterans.
And how is this going to affect the services that are being provided if they take away union rights?
I mean, all these employees could be at will. They could be fired for any reason. This could lead to privatization of the VA. That just takes completely our hand of the deal that we made with our nation's veterans that we would give that services. What are we going to do? Go pay some other private company 4 times as much to get 4 times less quality of care? That's not okay. These are trained professionals that are here that have experience with our nation's veterans, and they are providing the best level of care possible. But if these attacks continue, our services to our veterans are going to drastically decrease even more than they already have.
And Elon Musk was involved in Doge making these cutbacks. They also want to use AI to replace workers. Are you concerned about that?
Absolutely. AI cannot replace the human factors that we have within each other. There's no way that they can go and replace that human touch, that human emotion to help support our folks that we are here for. A computer is, everybody calls up a phone line and they get a computer, what do? Hang up right away. That's just not what it is.
And if you're disabled and have hearing problems and things like that.
Right, exactly. They don't want to talk to a computer. They want to talk to a human being. And by bringing AI in, is taking jobs away from United States citizens, Americans, everybody that goes and contributes to this economy.
And it seems like we have a growing oligarchy. The billionaires, they're taking over, they're directly running the government. Are you concerned about fascism in this country?
I personally am. I mean, there's a lot of authoritarianism going on right now. Fascism is definitely on the rise. I definitely feel that unions are a right avenue to advocate for the middle class and lower class folks that are in this country that are starving to put food on the table, starving to put, money in their bank accounts, maybe even put money on a home if they could afford it. Unions are on the right side of history, and America needs to be on that side.
And your union, NFE, what do you represent? Who do you represent?
We're a National Federation of Federal Employees. We're America's first federal union. We represent federal workers across the country, Department of Defense, the VA, United States Forest Service, Bureau of Land Management, Army Corps of Engineers, National Park Service. You name it, we probably cover it.
It seems like they're disassembling the government. I mean, the layoff of meteorologists, layoff of scientists. I mean, it seems like they're destroying the government. Is that really what's happening?
It definitely seems that way. We haven't increased federal workers since like the 60s. So to even cut down even more services than they already have, it boggles the mind. The public uses these services. They visit our national parks on a daily basis. They use the veteran services here all day long. And now we're going to reduce that to even more of a capacity. Shame on them. shame on them.
Well, it seems like they're hurting the working people of this country, the real public.
Nobody becomes a federal employee or federal worker to become a millionaire. We do it because we're dedicated and we're passionate, right? And we care about public service, right? This is an unthankful job, and we're America's workforce, and we work for America every single day. So for them to go and attack these workers like this it's disheartening. It's shameful, and it's absolutely wrong.
Straight out union busting, I think.
100%. I couldn't say anything better than that. Yeah, absolutely.
Dan Franco. I'm a rank and file member of Local 16, and like I think everybody out here, we're not thrilled about 400,000 union members losing their job. That ain't right. So, time to step up.
So it's all workers that are affected, all working people?
Oh, I think everyone in the country, but especially union people, because, they're the first ones in the crosshairs. If unions are gone, everybody's screwed. I think that should be obvious, but a lot of people don't seem to realize that. Right now they're like, oh, that won't happen to me, head in the clouds. That's dangerous, so we got to get the word out.
Concerned about fascism?
Concerned about fascism in America? Yeah, sure. We know our history. We know what happened in Germany in the 30s. Signs of that are happening here. That's not good, So, I think any worker who wants to have a job in 10 years ought to be out on the picket lines right now. This banner kind of says it all. No privatization. We should have these people keep in their jobs. Absolutely.
My name's Katie Phillips. I'm a psychologist here at the VA and a proud dues-paying union member, and just want to come out and support our services.
What union?
I'm with NIFE, so NFFE Local 1. Yeah.
And the cutback of services here at the Veterans Administration, they say that there's not really affecting the patients. What's your experience? Are you concerned about?
Certainly, certainly. So I know I feel like things have been made difficult for employees to get veterans the services they need, and it could increase problems in timely access to care, especially concerns about hiring freezes. Fortunately, the RIF is no longer a concern apparently, but I definitely want to make sure our vets are being seen in a timely manner. I also think that a major concern is that when folks are diverted to community care, those people are not necessarily trained specifically to work with military veterans as we are. I did the majority of my training for many years all within the VA, so specialized experience.
So particularly veterans have conditions that can't be addressed just outside any place else.
Correct.
And well, they say you contract out and they can take care of it. You're saying that that's really could be a problem.
Yes, correct. I would say so. I think that many people who are clinicians and providers within the VA have done a lot of training. VA trains an incredible amount of physicians, nurses, and psychologists and other mental health workers that serve, all around the country in various roles. But I believe VA is the largest training body for psychologists in the nation, for in terms of internships and residencies. So a lot of specialized experience.
And what has happened with the members? I know a lot of members are stressed out, or can't do their jobs, or layoffs. I mean, it sounds like a very terrible situation for the workers and for the patients here, the people who use it.
Yeah, it can be a problem just because we want to make sure that this is, a place that attracts folks to want to work here. And then, unfortunately, if folks do leave the VA because of the stresses, the workload then falls on others to take on, which we want to do because we want to make sure our veterans are getting the care they deserve in a timely manner. Yeah.
And have the unions got more activated? I know this is...
Yeah, I've gotten way more activated. So I, was always represented by NIFE, but, as of a while ago, and now proud dues-paying member, making sure that I'm contributing and making sure that we get turnout for events like this.
And the idea that they can take away your union or right to a union, what is that all about?
Yeah, I know. I was actually talking to one of the union representatives that I've been working with on some of my own things recently, and I think it's we still have our union is fighting, and we're still going to be.
So you're not going away, even though they say they're not going
anywhere. We're not going anywhere. That's my understanding.
Even though they said you should go away.
Yes, yeah, I know they would like us to, but Mark Smith, our incredible leader, I know he's and our other amazing union leaders are determined to make sure that workers are still supported, even if the contract is not officially recognized.
You're still fighting.
Oh yes, 100%. Yeah, for our rights as employees, so that we can serve those who served our country.
And helping the people who need it here, really.
And people, yeah, helping the people who need it the most. Absolutely.
So I'm Ignacio at CIU.
What is CIR?
CIR is the Committee of Interns and Residents. We are a union organization that represents residents and fellow trainee doctors all across the country.
And I understand that they train interns here. And what does the attack on the VA mean as far as the training of interns here?
Yeah, I mean, I think the attack on the VA healthcare and like the unions that are being attacked here will really affect residents. We work directly with all of the members of the unions that are being attacked today, and we work closely with them. We appreciate their work, and we love the VA. I mean, we rotate there, all sorts of departments, psychiatry, internal medicine, and we just know that unions, when we all come together, we're able to advocate for ourselves, for our patients. Healthy doctors, healthy nurses, healthy occupational therapists means healthy patients. So we really want to just make sure that everyone is together working towards making America healthy.
And Project 2025 says that part of the program is to privatize all public services, public education, public health care, set up company unions. Are you concerned about this agenda and what it would mean for interns, working people in this country?
I am concerned. Yeah, I think Project 2025 is going to be, I mean, the cuts in funding, we're already starting to see issues with that. And we treat patients on Medicaid all the time, so the government funding in particular is going to be hard. We work at the General as well, and we want to be able to provide care from patients for all walks of life, including those who are underinsured or uninsured. It's what I'm passionate about. It's what a lot of my co-residents are passionate about as well.
Medicaid cutbacks, General Hospital, a lot of patients are on Medicaid, UC. Are you concerned that people are going to die? And there's, I understand, 500,000 healthcare workers are going to get laid off with these Medicaid cutbacks?
We as a hospital work really hard to ensure that we provide care for everyone that walks through the door. We're worried that the cutbacks will make it a lot harder to get that care. But the safety net hospital of the General is one where we accept people who aren't on, they don't have to be on Medicaid. They walk through the door, we give them care. That said, I am really concerned about the funding that our hospital gets.
And the SEIU is one of the largest unions in the country. What do you think that the labor movement should do? Because it seems like a frontal attack, busting unions, saying you don't have a right to be in a union, and for that union to be recognized. What do you think the labor movement should do about it?
What we're doing here today. I think we need to make sure that we support our union brothers and sisters, our union siblings, as they continue to try to curb away from our rights, basically our workers' rights. CIR is not directly affected by this. We still are unionized with this executive order, but that doesn't mean that we're not affected by it indirectly, and so we have to stand up together. There's that classic, don't panic but organize. So we all, even if you're not a union member, I think joining your local like nonprofit organization, doing something to make sure that your voice is heard and that the right people are put into office, I feel like that's going to be the answer to fighting local politics.
My name is Heather, and I am the NEFI Secretary-Treasurer. I'm also a nurse here at the VA, but I'm speaking only for myself, not on behalf of the VA.
And there seemed to be a real fear that the services provided to veterans are really going to be hurt as a result of what the cutbacks and that kind of thing. Are you concerned about that?
Of course, yeah. I'm concerned. I'm concerned that people have left, that more people are leaving. I think especially in mental health from what I've seen, but in other departments as well. And those staff leaving means that the other staff have to cover more people, and there's less appointments to go around. So that means that veterans in crisis are having to wait longer to get care. And
the rate of suicide by veterans is very high. The stress level, what they've gone through, is very problematic as far as getting care and that kind of thing.
Yeah, I mean, we all know this, and that's something that we need appointments to offer veterans. We need therapy to offer veterans, and we have clinicians here. We've got doctors and nurses and psychiatrists and psychologists, and all other kinds of therapists who are some of the most creative and just wonderful people and best clinicians that you would ever meet. And we have amazing veterans here that we serve, but we just don't have enough staff.
Have you been affected here? I mean, has this facility been affected?
I can't really speak to how I've personally been affected, but I would say in different jobs that I've been in, sometimes we can't find appointments. I think particularly in mental health, it takes longer to get appointments.
And that could be life and death for people.
It absolutely can be life and death.
And what can people do about it?
I would say the best thing that people could do, speaking as an independent citizen, not a VA staff member, is that people can call their members of Congress, demand that that everybody work to stop the privatization of the VA, and fight for our rights as workers to organize. I can definitely say I've been an employee here for 18 years, always been a union member, and I have seen time and again how the union has protected staff jobs and also done things and created improvements to make patient care better.
I'm John Kelly.
And you work here at Veterans?
I do, yep. I'm a nurse. I work here at the VA in San Francisco.
And you said when you spoke you were in the Gulf War?
Yes, sir.
And what happened there?
What happened?
A lot of people need care who were probably in the Gulf War.
Yes, yeah, I think that's one of the, Vietnam and Gulf War, some of the largest populations of vets who get care here.
And the kind of care that they get here, is that specialized because of the conditions they've been through?
Absolutely. I mean, when you're serving a single population, you can't help but get specialized in serving these folks. Everyone sees them, we all see them day after day, and people are passionate about seeing veterans. And so the care is just absolutely, amazing.
And what do you think about Trump administration saying that they're not going to recognize the union, take away your union contract?
I don't know what to say, I mean, it was a big shock, and like I was just talking with some other union folks, it just, they did exactly what they said they were not going to do. So, we're all just kind of waiting for this to get turned around.
And it's not just, veterans, public education, Medicaid. A lot of people on Medicaid are going to lose their benefits. 500,000 healthcare workers may get laid off. What's the solution?
I don't have a solution, but I know that's going to affect a lot of veterans. More veterans are being, fired than ever before. He's fired more veterans than any president ever, even thought.
So the workers that are losing their jobs are veterans, and he's firing these veterans.
That's right. That's right.
You know any?
There was a veteran here who was fired. The courts did overturn it in San Francisco, and he did get his job back. So we're a little bit more lucky. There were federal forest fires. Firefighters, they lost their jobs, and there was just horrible losses all over the country.
And he says he doesn't have to follow the Constitution. He makes the law as he goes along. Mm-hmm. The federal Supreme Court says if he declares it an official act, he can get away with it. You think this is the start of fascism?
I think he took the same oath I took, so I think he needs to maybe take it again.
And what can people do who want to support the veterans and the workers here?
Call your representative. Be loud, make noise, tell everybody, tell your friends. This is happening.
Yeah, my name is John Tuve. I'm retired RN here. I also I'm a nurse, writer, activist. I have my own paper called People's Ideas, which is dedicated to the power of workers. The system here right now is becoming fascist. So what we need is an organization of workers for the power of workers. Without professional organizers, once you become a professional organizer, I think your class interest changes. So there is a class consciousness changing in this country, we hope, and we need to start organizing now before it's too late.
And they're spending billions of dollars on war. on Ukraine, on genocide. I mean, what do you think about where the money's going? In this country?
Where the money's going is disgusting and appalling. I could barely watch the news because every time I see Gaza, I want to kick the TV. I belong to a group called San Bruno for Palestine. We have rallies every Thursday between 4:30 and 6 in front of the San Bruno City Hall. Everybody's invited. It's organized by people that are Palestinian, that are actually either born in Palestine or have relatives there. It's a really good group.
And how is that connected to what's happening here?
Well, what's happening here, it's against the fascists. It's trying to resist the fascism that's happening here, because what's happening in Gaza is very much related to what's happening here, because it's fascist-led. I mean, when the Democrats were in power, or when they were playing more of the lead role, the thing in Gaza was still happening in full bloom. Biden didn't stop funding Israel at all. So basically it comes down to, we're an imperialist country, all right? And it's really hard for the people of this country to admit to it or to address it. Because once you admit that you're an imperialist country, either you're going to accept it as being something human nature and then we want to be on the top dog, or you set out to change it. And if you are to set out to change it, it's not a fun game, but it's well worth it. Let me tell you, it's well worth it. I've been fighting this thing for over 30 years and I don't regret 1 minute of it. I'm very proud of my actions with the people from San Bruno for Palestine, because there's no more evil in the world that I can see right now than what's happening in Gaza. What's happening here at the San Francisco VA is evil too, and it's all somewhat connected, because it's in the interest of the working people, of the interest of the elites, to get more out of the workers and also to subjugate the land and labor of other countries. They don't want any kind of independent Arab movement in the Middle East. That's why they're putting so much pressure on Iran, so much pressure on the Palestinians, because the Palestinians, they're an amazing group of people. They just will not relent. I mean, they've been murdered, killed, and you know what? Hamas, which is not an organization I would belong to, but it is a resistance organization, and it may be stronger now than it was on October 7th, because once you kill once you wipe out your family, you develop what I call a Patrick Henry attitude, which is give me liberty and give me death. And that's what's happening right now in Gaza, and people don't seem to understand that.
I'm Courtney. I'm a nurse that works here at the VA. We're just picketing all the changes to veterans' health, and for nurses, we just lost our union, or the contract for the union, so we're just making a stand.
What do you think about that, telling you don't have a right to have a union or a union contract?
Well, actually, it's quite interesting, because our director issued a statement that was saying all the positive impact that we'll have without a union, which is quite interesting, right? Sure, but it definitely has more pros to have one than not. Yeah.
What's the goal of taking away your union recognition?
Kind of feels like we don't really have a voice to back us up anymore, so.
Isn't that part of democracy, having a voice?
Yeah, I mean, we could still get together and band together, but I guess we don't have representatives to help us.
And are you worried about the cutback in services or privatization?
I am, for veterans, because as a nurse here, a lot of the veterans here really love the care that they get here. I would say we get a lot of positive reviews, and a lot of veterans come back to our unit to thank us, and so if they have to go private, then I don't know if that'll change the care that they get.